Okay, so this one's called Clam Shell.
Okay.
This is another great one that's good for hips, pelvis, core, glute. And so what we're going to do is you're going to be laying here in a neutral position. You notice that her feet are lined up with her glutes, with the rear end here. They're not back behind her or too far in front of her. They're nice and straight behind there. And then what we'll end up doing is she's going to bring her knee up. And as she's coming up nice and controlled, she's going to feel the contraction right through here. Feel that in there?
Yep.
And so she's going to keep that controlled. Now, if she brings it up too high, so if she comes up too high, you'll notice her hip rolls out. And when it rolls out, that's not good. That's not getting us where we need to be. That's causing more problems, not good. So what we want to do is we're going to keep it nice and controlled, bring it up to the height to where you don't feel your hip when it roll out, and you'll feel the contraction. Now, another thing that you can do is you can have your hand here on the hip. And when you put your hand up on your hip, you can feel the contraction here, right where this thumb is. That's where we want to feel that contraction there. That's the area that we're trying to get to strengthen and stabilize what's going on with your hips and pelvis.
Yeah, I feel it right under my thumb, and it keeps me from, makes me think about not rolling all the way back.
Perfect. So when this gets too easy, and you're doing it enough, then what we can do is we can add another level of difficulty and use the TheraBand. And when you put this on, you're going to put it just above the knees, and you want to double knot it. I like using the flat ones as opposed to the round ones because then it doesn't roll on you. And in this exercise, it's really easy for that to roll on you. So again, she's still in the perfect position, nice and neutral, and then what she's going to do is thumb on the hip. She's going to come up, contract, and let it come down. Notice she's doing it right, that whenever she's coming up and then coming down, she's controlling the contraction. She's letting that happen as opposed to it.
Yeah, it's easy to let the band pull you down.
Right.
Yeah.
So instead, we want to make sure that it's being done correctly, just like this, and this is how you're going to